Madam President, honorable ministers, Madam Director General, heads of delegations, ladies and gentlemen, good afternoon. We all woke up this morning to the news that yet another senseless and ruthless terrorist attack in Manchester. I condemn it in the strongest term possible. My thoughts and prayers are with the victims, their families, and the people of the United Kingdom. Now I'll come back to myself. I'm actually often astonished when I think of the path of my life has taken. When I was 7 years old, my younger brother died from one of the many child killers in Africa. It could easily have been me. It was just pure luck that I just survived. Pure luck. I didn't have a chance, actually, to stand in front of you. And yet, I stand before you today as a candidate for the Director General of the World Health Organization. Coming from this background, knowing survival to adulthood cannot be taken for granted, and refusing to accept that people should die because they are poor. I have dedicated my life to improving health, to reducing inequalities, to helping people everywhere live more productive lives. That commitment has driven me throughout my life and career, and it's what brings me before you today. That commitment, and today I seek to lead the World Health Organization and serve its noble mandate. And I make the following 5 promises. Number 1, I will work tirelessly to fulfill WHO's promise of universal health coverage. And number 2, I will ensure robust responses for the health emergencies to come. And number 3, I will strengthen the front lines of health and ensure country ownership. Number 4, I will transform WHO into a world-class workforce. And number 5, I will place accountability, transparency, and continuous improvement at the heart of WHO's culture. Last December, I met a medical student in Santo Domingo, Dominican Republic. He suffered from kidney failure and was receiving dialysis 3 times per week. I asked him how much his treatment costs. He didn't know. He said the government covers it. Without it, he would be dead. His treatment should have made him miserable. But he was smiling and full of hope. He told me when he completes his medical training, he will work to help others. Because of his access to health, this young man is alive. He will thrive and give back to his community. His story touched me very deeply. Universal health coverage represents our most basic common values and aspirations, as you can see from this young man. It's about delivering health and hope to our people and investing in the prosperity of future generations. That's why I always say all roads should lead to universal health coverage. Universal health coverage should be the center of gravity in our activities. Universal health coverage means, as you know it, quality diagnosis and care, ensure access to quality drugs, and access and address the financial barriers to health. Universal health coverage is a matter of political commitment, and we have to ensure political commitment if we are going to achieve it. Many countries have identified solutions that fit their own contexts, using public facilities, or private, or the mix, financing programs through tax revenues, or insurance, or a mix of it, or other options. What's important is the goal, achieving universal health coverage. The means are many. This is my first commitment to you. I will not rest until we have made good on our promise to universal health coverage. Ensuring robust responses for the health emergencies to come is my second commitment. Last week, I visited Democratic Republic of Congo and was able to witness firsthand the extraordinary leadership of Minister Oli Kalenga of DRC. The country's response to the Ebola outbreak was much faster than we have ever seen in the past. Yet, many challenges remain. We must go further and implement the emergency reform with a sense of urgency. We must also focus more and strengthen country capacity on the front line. I have done this before in my country. We need resilient capacity for preventing, detecting, and responding to health emergencies in countries. Without this, we will always be one step behind in our response, and that is simply unacceptable. Without this, I think we cannot make a difference. Strengthening the front lines of health and country ownership is my third commitment. Strengthening the front line health means empowering countries working towards their own priorities, building strong and resilient health systems with focus on primary health care and community engagement, addressing health workforce, increasing health financing, improving data and information systems using data for decision-making, transferring the skills and knowledge to our communities so they can produce their own health, a focus on health promotion and disease prevention, health as a product that can be produced by the individual himself or herself. I know what it takes to strengthen the front lines of health and to innovate around the constraints. In Ethiopia, I designed and implemented a comprehensive health system reform. In 6 years, we built a primary health care, built more than 16,000 health posts, 3,000 health centers, deployed more than 40,000 health extension workers. And all the required systems were installed. It was a massive effort, delivering massive results, meeting almost all MDGs. High speed, big volume, and good quality was our motto. We translated our reform into impact. Let's step back now for a moment to consider the major trends and the challenges of the future. Mental health and stigma continue to afflict communities. Non-communicable diseases are now the largest cause of global disease. Just look on the streets of our cities. Obesity, smoking, poor diets, sedentary lifestyles. It's a perfect storm. A storm, but a silent killer in the making, affecting all regions and all income levels. It's costing us dearly today. Will only worsen if we don't shift the trajectory. We must reverse the trajectory. We have made promising progresses in HIV, TB, malaria, neglected tropical and other communicable diseases, but they persist as a major cause of death and suffering still. We should not be complacent. The fighting is not over. It's not. We have established a number of important goals. We must complete the task of polio eradication. We should end preventable diseases of newborns and children and ensure giving birth is a celebration for every mother. We must focus on women, children, and adolescents and ensure universal access to sexual and reproductive health care services and tackle gender-based violence. We must accelerate the ratification and enforcement of the protocol to eliminate illicit trade in tobacco products. We're very slow on that. Very few countries have ratified it. We must confront and address the commercial determinants of health, including unhealthy foods, drinks, tobacco, and alcohol. WHO's mandate is about health, but we must also recognize and respond to mega trends that will impact the health landscape more broadly, including climate change, ongoing regional conflicts and terrorism, like what I said earlier, and the migrant crisis, growing economic disparity and social determinants of health, and above all, the geopolitical shift with profound, dangerous changes that everybody is witnessing. This is a wisdom inherent in the Sustainable Development Goals, what we call the 5 Ps. We must have political leadership and innovative response to the changing landscape, adapting new models and smarter approaches. Antimicrobial resistance is a perfect example of the complex, multi-sectoral, multi-stakeholder challenges we will increasingly face in the future, requiring a more agile, strategic, innovative, and collaborative leadership. WHO must rise to the challenge by building effective partnerships like One Health. I believe WHO's greatest asset is its staff. But in the context of the complex challenges we're facing, WHO must evolve to have a world-class workforce, and this is my first commitment. We must start by invigorating the mindset of our staff. I will foster the same can-do and will-do culture that I successfully implemented or brought to previous institutions, united by our shared vision and goals. WHO should be the employer of the choice for top-notch professionals that will bring science, innovation, and results. In particular, our strategy must improve WHO's geographic and gender representation, especially in leadership positions. There are skilled professionals from all over the world and unprecedented and understand and represent the complex geographic, cultural, political, social, and gender dimensions that our work must address. My final commitment is that I will place accountability, transparency, and continuous improvement at the heart of WHO's culture. WHO must evolve to be more transparent, responsive, effectively managed, adequately resourced. To ensure sufficient resources, we must expand donor base, communicate more effectively the return on investment. But above all, we must earn confidence through our results. We must also harmonize our work and shared vision across WHO with their clear priorities and regular monitoring of progress. When I was chairing Global Fund, that was what I did. I installed independent panel to show us the challenges we are facing. We changed Global Fund based on the independent panel's recommendation. If I am elected DG, I will submit myself and WHO to the same level of rigorous independent review. Distinguished colleagues, I want to lead WHO as DG because I have seen firsthand the power of health to lift individuals, communities from despair into hope. I believe WHO is still relevant. My distinguished colleagues, as you have heard me say before, while WHO has never had a Director General from Africa, no one should elect me because I am from Africa. But if you agree, there is a real value in electing a leader who has worked in one of the toughest health environments and transformed the health system. Who can bring a fresh perspective, an angle with which the world has never seen before. With experience in political leadership, with experience in technical proficiency, and also a convener, and build partnerships. I will work with you, and I'm really committed. I will listen to you. I was one of you, and in your shoes, and I can understand you better. And I will never forget this is fundamentally about people, whether they live in developed nations or the developing world, whether they live in developed nations or the developed world, whether too many lives are cut short, like that of my brothers and many others. I promise you, I will get up every day determined to make a difference. Thank you so much, and I'm ready to serve. Thank you.
Спасибо.